Mumps is a contagious disease. It is caused by a virus. This virus usually affects the salivary glands. These glands are located in your cheeks and jaw. When these glands swell, it causes puffiness and pain. The swelling is a distinctive sign of mumps. It often affects both sides of the face. This gives a person a chipmunk cheek appearance. Mumps can make it hard to chew and swallow. Mumps was very common in the past. This was before the mumps vaccine was developed. Now, it is much less common thanks to vaccination. Mumps is easy to recognize because of the swollen cheeks, but it's important to know the other symptoms too. This is because not everyone with mumps gets swollen glands. The first symptoms of mumps often feel like the flu. You might have a fever. You might also have a headache or muscle aches. Some people feel very tired and lose their appetite. These early symptoms usually last a few days. Then the salivary glands start to swell. This swelling can cause pain and tenderness in the cheeks and jaw. Mumps is highly contagious and can spread rapidly in close contact settings. The virus spreads through saliva and mucus, which are expelled when an infected person coughs, sneezes, or even talks. This means it can spread through coughing, sneezing, and even talking, especially in crowded places like schools or offices. The virus can also live on surfaces for several hours, making it easy to pick up. If someone with mumps touches a surface, like a doorknob or a table, they can leave the virus behind, which can then be picked up by others. Another person might touch the same contaminated surface and then touch their nose or mouth, allowing the virus to enter their body. This is how they can get infected without direct contact with an infected person. Mumps is most contagious before the swelling starts. Often when people don't even realize they are infected, people with mumps can spread the virus for several days before they show symptoms, making it difficult to control the spread. They can also spread it for up to 5 days after symptoms start, which is why isolation during this period is crucial. This is why it's important to practice good hygiene to prevent the spread of mumps. Wash your hands frequently with soap and water. Cover your mouth with a tissue or your elbow when you cough or sneeze, and avoid sharing personal items like utensils, drinking glasses, and even towels to minimize the risk of transmission. Complications from mumps. Mumps is usually a mild illness, characterized by symptoms such as fever, headache, muscle aches, tiredness, and loss of appetite. It often leads to swelling of the salivary glands, causing puffy cheeks and a tender, swollen jaw. However, it can sometimes lead to complications, especially if not properly managed or if the patient is an adult. These complications are more common in adults than in children, and they can range from mild to severe. One possible complication is orchitis, which is inflammation of the testicles. This condition can be quite painful, causing swelling and tenderness in the testicles, but it rarely leads to infertility. Another complication is oophorytis, which is inflammation of the ovaries. Like orchitis, oophorytis can be painful, causing discomfort in the lower abdomen, but it rarely has long-term effects on fertility. These serious complications include meningitis, encephalitis, and hearing loss, which can have significant impacts on a person's health. Meningitis is inflammation of the membranes that surround the brain and spinal cord, leading to symptoms such as severe headache, fever, and a stiff neck. Encephalitis, on the other hand, is inflammation of the brain itself, which can cause confusion, seizures, and other neurological symptoms. Treating mumps. There is no specific treatment for the mumps virus itself. Treatment focuses on relieving symptoms and making the person comfortable. Rest is very important. Your body needs energy to fight off the virus. Drinking plenty of fluids is also important. This helps prevent dehydration, especially if you have a fever. Over-the-counter pain relievers like ibuprofen or acetaminophen can help reduce fever and ease aches and pains. You can also apply cold packs to swollen areas to reduce swelling and discomfort. The MMR vaccine, your best defense. The MMR vaccine is a safe and effective vaccine that protects against 3 serious diseases: measles, mumps, and rubella. These diseases can cause severe health problems, but the MMR vaccine provides a strong defense. It's the best way to prevent getting mumps, which can lead to complications like meningitis and hearing loss. The MMR vaccine is given in 2 doses to ensure full protection. The first dose is typically given to children between 12 and 15 months of age, which helps build initial immunity. The second dose is given between 4 and 6 years of age, ensuring long-term protection as children grow. The MMR vaccine is very safe, with a long history of use and rigorous testing. Side effects, if any, are usually mild and temporary. They might include a low-grade fever, soreness at the injection site, or a mild rash, which are all normal reactions. These side effects usually go away on their own within a few days, requiring no special treatment. Getting the MMR vaccine not only protects you from these diseases, but also helps protect others who can't be vaccinated, such as infants and people with certain medical conditions. This collective protection is crucial for public health. This is called community immunity or herd immunity, and it plays a vital role in keeping everyone safe.